Well, we try to do it as you would expect a scientifically based company, engineering-based company would do. Let's look at our project in the Democratic Republic of the Congo. Before we started any of our health and medical initiatives, we did an extensive baseline health survey to determine what we were dealing with, what the major issues were, and where we needed to initially direct our resources. It does no good to bring in a sophisticated medical and health infrastructure if there's no solid foundation. I will give you an example. The USAID got in touch with me a couple of years ago, and they said, we have 30,000 insecticide-treated bed nets. Who do we send them to? And I said, send them to? And they said, yes. Who do we send them to help in the Congo? Well, I said, did you realize, or do you realize, that only 8% of the population knows that a mosquito is responsible for malaria? So why should they sleep under a bed net? So what one first has to do is go in and socialize the root cause of malaria and what preventative measures should be taken. If one does not do that, then the bed nets will be used as fishing nets and dresses. One also has to properly hang the bed nets so that they can be effectively used. So what we try to do is start at the bottom and work up. Everybody wants us to build them a hospital with the capability of doing major surgical procedures. But as we see in the Congo, as one sees with our Clean Water and Sanitation Initiative, what good does it do to be able to perform technical surgical procedures if the persons that we're operating on don't live long enough to develop any of the surgical illnesses requiring intervention because they're dying of living in filth and drinking contaminated water. Yes, we do. Let's look at HIV and AIDS in Indonesia. Papua, Indonesia has one of the highest prevalence rates of HIV and AIDS. What we have done there is become proactive, and we require every member of our workforce at their yearly medical examination to opt out of an HIV test. Rather than offering it and having them opt in, they're going to get it unless they opt out. Now, what did this simple strategy do? Opt out rather than opt in. We went from testing 30 or 40 of our employees a month to 500 or 600 a month. Now, what we have seen this year with over 15,000 tests, that the HIV prevalence is 0.47%, where in the community it's running almost 5%. But we also distribute 30,000 condoms a month. We have a very extensive education program, and we feel that if we didn't take these initiatives, the prevalence rate would be closer to what one sees in the community. Why is it different at Freeport? Because our employees are living in the community, but they are being literally bombarded with educational material, prophylactic material. We're making them aware that HIV and AIDS is a real issue. And that's why we feel that we're seeing the reduction in prevalence as compared to the community. So yes, we measure that. We also measure what we have done with malaria. Freeport-McMoRan was the first company or the first entity in the history of the Democratic Republic of the Congo, Zaire, the Congo, the Belgium Congo, whatever you want to call it, was the first entity to come in and have a professionally conceptualized, organized, and implemented malaria control program. The attitude was, you just get malaria and you get over it. Sometimes you don't get over it. Before we started our malaria control program, we did a wide site survey with rapid detection testing and then slide confirmation. 78% of everybody in the community either actively had malaria or had recently had malaria. Our most recent survey shows that 24% of the population has malaria. So that's been a substantial reduction in the prevalence of malaria. How did we do this study? Well, we used school children, 7 to 12 years of age, because school children do not tend to move around as much as the general population. Men tend to wander in and out of communities, depending on work or whatever. But school children are a better snapshot of what's going on in the community. So twice a year, in May and October, we do a school surveillance program in about 7 different locations, and we test 5,000 children, and that's how we get the data points. Many times, entities and governments and corporations and NGOs can make the statement, oh, well, we've gone in and we've proven this or proven that. Or we've improved, rather not proven, but improved situations. Until one accurately measures it, one doesn't really know how much good they're doing. So yes, we try to have very valuable data and accurate data over what we're doing, because it doesn't do any good to operate a program if you don't have an accurate interpretation of the results. Well, it's part of corporate responsibility and it's part of core business. Now let's take corporate responsibility first. Freeport-McMoRan operates on 5 continents. North America is not as large a health issue as obviously Asia, some parts of Europe, South America, and Australia is really not a health issue for us. Africa definitely is. Corporate responsibility, because we go into these communities and we are guests in these communities. We don't go in as the big corporation and pay a royalty and extract and leave. Our CEO and our chairman, Jim Bob Moffitt, believes strongly that we should leave communities better off than when we arrived. So that is a corporate philosophy. And we're going to do our part in these different areas of the world where we operate so that when we leave, and one day we will because there's a finite amount of mineral, so that when we leave, the government, the community will say, we are glad Freeport was there. Freeport made our lives better. That's the corporate responsibility side. Let's look at the corporate operational side. We hire most of our workforce from the local community. If they are suffering from diarrheal diseases, cholera, malaria, then they're not working. If they're not working, the amount of tons of oil that we are extracting is reduced. If the oil we extract is reduced, the amount of mineral that we sell on the market is reduced. Thereby, the amount of profits the corporation makes are reduced. And the Wall Street then says they're not producing the way they should, or as effectively, or they're not as profitable. So our company suffers. It behooves a company to have a healthy workforce. Our chairman, Jim Bob Moffitt, has stated over and over again that Freeport-McMoRan's most important resource is its people. If we take care of our people, we will maximize the resources in the ground. If we don't take care of our people, we will not maximize our resources in the ground. So there's a corporate social aspect and there's a corporate operational, but it goes together.